welcome back to Rohrich Knows Podcast, helping you become a better and more informed you. I'm Dr. Rohrich. I'm a plastic surgeon in Dallas, Texas, and today let's talk about the matrix and the adipose fat matrix. And what is it? What is it really? And is it a filler or is it not? So this is a very unique type of matrix that actually it's made by a company called MTF, and it's called Rejuvenation. And it's a new treatment that when injected, it gradually replaces fat-related fat loss and volumized contour deficiencies. And I think that's very appealing because it's one step closer to helping replace like with like. And really, it's a biocompatible agent that really is got all the same growth factors, proteins, and collagen that's found in your own body's fat. And when it is injected, it acts like a honeycomb that then is filled with your own body's fat. It attracts your own body to build up the fat over the course of several months. So I think it's it's going to be very, very popular. The challenge is it's actually challenging to make. And so, you know, Rejuvenation is a true biomatrix, and you inject it where fat is. So you only put it in the deep layers, mainly in the deep areas where there's fat loss. So you want to replace like with like, and that's done everywhere in the body. Now, why is this so popular and so important? It's because people are tired of fillers. The Stay Puft Marshmallow, the pillow look, you know, always that overdone look. You know, it just doesn't look good because people don't know when to stop. And I blame the injector as much or more than the injectee, because people are incentivized to inject it because of financial gain. And I spend half my day when I'm doing injections telling them, no, I'm not going to do that. No, I'm only going to inject these areas. Because if you understand how people age, you just can't push them up, because fillers fill, they don't lift. And once you know that, if you keep filling, they look overdone. So let's not do the filler or the overfilled look at technique, because you can see it every day. I see it every day, and I see it all the time on TV, if you understand how people age. And that's why it's important to understand how we age and how aging is predictable. So know before you go. See an injector or a board-certified plastic surgeon that really understands facial aging. I'm a facelift expert and a rhinoplasty expert, so I operate on faces every day. So I know what works and what doesn't work. So Rejuvenation is really not a filler. It's an off-the-shelf allograft adipose-derived matrix. So what does that mean? Well, it means that it contains the same matrix proteins that are found in native adipose tissue, and it's designed to get similar results, and it eliminates the need for surgery and downtime many times. But obviously, in the operating room, I use patients' own fat. Unless they don't have any fat, I'll use this as an augmenter to help me improve my results. So Rejuvenation comes from a donor to a recipient, and so you remove the human tissue and you maximize the donor gift in these patients. So it's an allograft, and you're taking it and you're specially processing it aseptically, and it's cleansed, but it's sterilely processed so that you don't remove the essential matrix, the essential native adipocytes. So what you retain is the angiogenesis, the epigenesis, and the cellular attachment. All these collagen components are maintained as they are found in the matrix in normal tissue, and that's the key. So it acts like a honeycomb. So you have the matrix, and then you're placing it in place, and then you're actually getting it, and you're putting it in place, and then the patient's cell then replaces it. And it's beautiful because it does that very, very nicely. And then the matrix grows, and it's your own fat. So isn't this better than most fillers? I think it's phenomenal. And I think that's really what you want to do. You want to get the matrix, and you put it wherever there's fat is present, you know, and obviously you can do it in contour defects, in the face, in the breast, in the body, and I use it often in combination with other types of autologous fat or fillers. but it really has amazing applications. So you have to understand the facial fat compartments, which we described in 2007. You can inject it in each of these facial fat compartments. I prefer to inject it in the deep cheek areas and the jawline. That's where I like to use the matrix better. And obviously the treatment and injection should be done deeply and into the matrix. And I go antegrade, retrograde, and we'll show you an example of how to do that to be safe. And obviously don't avoid it in areas where you shouldn't be injecting where there's no fat, like the tear trough or the lips. You don't do it in those areas, and avoid it in intramuscular areas. And then you have to manage the patient's expectations. They'll have some swelling and tenderness, and in that area, but most of the time, it really is minimal when I have them apply cold compresses for the first 24 hours, and after that, they're fine. They have minimal bruising. And these are just some representative results that have been provided by the company that show the adipose sites after, this happens to be 6 months after 2 treatments with age-related volume loss in the nasolabial folds and cheeks. And here's another one from the same type of result with age-related treatment of 3 cc's injected in each side, giving you volumized shaping. And it's a very dramatic result that is a courtesy of Dr. Leif Rogers, which really shows a post-face neck lift and treated with Renuva, which really shows an amazing shape and contour in this result. Same can be done with breast shaping, especially if you want to get more improvement of asymmetry and you don't want to go to the operating room, you can provide breast shaping and shaping contours. And then this also is a video that actually shows how you can inject Renuva into the hand, and I think that works great. I like using Renuva if the patient doesn't want to go to the operating room, and I think it works beautifully in these areas. You can really shape it and inject it in this area and really get you some really nice shaping and contouring in this area. And when you inject it, then you can actually contour it, and then you can inject it using multiple different injections, and then you can massage it into place. And I think it works really, really great in this area. Then you can massage it in place, and you can really do this. And I do this with autologous fat as well, and you can really get an amazing, amazing results with this. And so I can tell you these are types of results you can get with that. And then I use it a lot in the face, in the facial shaping and contouring, especially in the facial fat compartments, and I'll use it in the deep layers, as well as in the nasolabial folds, the deep malar fat compartments. These are very, very popular, and these are the techniques I use in facelifts. These are the types of areas I inject with normal fat. You can see this is a lift and fill facelift with central facial fat augmentation with autologous fat, which is truly a matrix. It's the patient's own fat. But Renuva can be used as if you don't have fat or you want to do it in the office. You place it in the superficial and deep fat. It comes prepared in 1.5 and 3 cc increments, and you can blend it. And I actually like to blend it and volumize it with additional lidocaine, so I can put it into a 21 gauge needle, and that works beautifully in these areas. And you can then use it very, very meticulously. You place it in the subcutaneous area, antegrade, retrograde, and obviously doing it so that you can avoid some of these blood vessels. And the key is to stay deep and do antegrade and retrograde injections. And here's such a patient where we did injections in this area, and we're marking the patient, and you can see how we're doing a 4-point malar augmentation in this patient in the lateral zygoma, malar, deep malar area, jawline, and chin area. And I think this is very, very powerful technique where you can use this and really powerfully use it to shape and contour the entire area. And so it's blended like I talked about, and then you inject it in these areas. And this just shows an example of how we're doing it, and we're just shaping it and contouring it in this area. And then here it is where you've blended it and you're using it, the blended Renuva in this area, and you're shaping it in the area, and you're going from the high malar arch to the nasolabial fold and deep area, and here it is injected in this area, and you're doing it very modestly in each area. You're going antegrade, retrograde in the area, and you're injecting it in the deep malar area, and then you're also injecting it into the nasolabial area, and you're doing it in the deep malar area, and again, really giving it a fantastic shape and contour. This is all done with topical, and then you can also do it in the area around the jawline and the shaping, and you're doing it again in a radial contouring area, shaping it and contouring it in this area. It works great. And then you can see we've done the shaping in the malar area and the contouring, and we've done it beautifully in this area. It looks great. And then you can see you really can have comparing one side to the other, and it looks really quite natural and beautiful in this area. And then this shows it in the jawline here where you're doing it. This happens to be with a cannula, and you're putting it into the anterior jawline from the angle of the mandible. You've already done the lateral chin area, and you're doing the lateral jawline, and then you're going to be going anteriorly and doing the vertical ramus as well in this area, and you're shaping it and contouring it as well in this area. And it really shows it beautifully. And then you can also do this in an antegrade, retrograde manner in doing the jawline and shaping it. So you can see here is the patient at 3 months, and you can see we've done 2 sessions spaced 6 or 8 weeks apart. You can see the fullness and volumizing of the malar area, and the shape in the cheek and the jawline is really quite remarkable. And all she had was shaping with 2 sessions of Renuva in this area, really giving you shaping and contouring in these areas. And then you can also see, this happens to be another patient, 1 session, blended malar augmentation in the jawline and also in the malar area, 3 cc's total to the cheek at 4 months, really giving you some improved shape and contour in this area. So in summary, Renuva is truly a matrix. It's not a filler. It's a treatment. It replaces volume for volume. And it's the first off-the-shelf solution to replace age-related fat loss. And it really works remarkably well because you're replacing like with like. And that's why I really like it. It's an extracellular matrix. And it's really a phenomenal new addition to our armamentarium in the management of aging and revolumizing and restoring like with like in facial rejuvenation. So please give me your comments and thoughts, and know before you go. Until next time, stay safe and stay informed.